think I'm ready to expand my skill set. I wonder if anyone offers a certification program.
I'm really worried about protecting myself and my patients from COVID.
I don't know if I'm delegating this task properly.
We need better legislation to prevent maternal death. I wonder how I make this happen.
I know it's the end. Just let me die in peace. I don't want to be resuscitated. I wonder what my nurse is going to say.
All right. The American Nurses Association, a presentation by Jamie, Amber, Michael, Danielle, and Joy. We begin with the history of the ANA. The demand for nurses in the U.S. began during the Civil War. Not long after, nursing training schools were formed under the principles of Florence Nightingale. The nursing graduates soon realized they needed to validate and unify their profession. So in 1896, a small group of nursing delegates met in New York to discuss the need for standardized education and an ethical code to guide the profession. They named their new organization the Associated Alumni of Trained Nurses of the United States and Canada. In 1911, they were renamed as the American Nurses Association. Today, the ANA works to represent the 4 million registered nurses in the U.S., with affiliate branches in every state and territory. ANA Maine in Kennebunk has represented Maine nurses since 1912. The ANA is big. The direction of the ANA is governed by the ANA's Membership Assembly, which is the democratic governing body of the ANA. It is comprised of 200 representatives from state members like Maine, affiliate nursing organizations, ANA subsidiaries, and the board of directors. The Membership Assembly works with the board to direct nursing committees and councils. Officially, there are around 172,000 members. ANA headquarters are located in Silver Springs, Maryland, and they have an annual revenue of approximately $51 million. ANA membership is for registered nurses only. Students can register for free as subscribers to receive limited access to online materials. The recommendation is to join at the state level. In Maine, membership rates are $175 per year or $15 per month. Benefits include the opportunity to influence state policies, networking opportunities, access to ANA publications, discounts for ANCC credentialing, and other personal and financial perks.
Since 2016, the ANA has evolved into the ANA Enterprise, which includes the American Nursing Credentialing Center, the ANCC, the Foundation, and the ANA. The ANCC offers specialized credentialing for nurses and awards magnet recognition to healthcare facilities that demonstrate the highest standards of nursing excellence. Maine Medical and Midcoast Hospital have magnet recognition. The Foundation is the philanthropic branch that funds programs that serve the nursing community as well as the public. Finally, the ANA provides guidance to nurses on achieving high nursing standards. They advocate for the profession, and they publish peer-reviewed journals, American Nurse and Online Journal of American Nursing. The mission statement of the ANA is to lead the profession to shape the future of healthcare and the nation. This statement is reflected in their ongoing achievements over the past 125 years. This timeline provides only a quick glimpse of their accomplishments, but includes becoming a founding member of the International Council of Nurses in 1905, the lobbying for the 8-hour workday in 1934, and their support of the Affordable Care Act in 2012. To promote advocacy, the ANA creates official position statements that offer guidance for nurses on the numerous issues that they may encounter while practicing. Examples include staffing improvements, issues with drugs and alcohol, ethical dilemmas, and safety and privacy issues. These statements highlight their advocacy for nurses and for the nursing profession, as well as for patients' rights and healthcare reform. The next part of the presentation highlights some of these efforts.
First, the ANA guides the nursing education. The ANA has advocated for nurses to practice with a minimum BSN education since 1965. The idea is that increased education correlates to better patient outcomes. A 2013 study by the University of Pennsylvania found that hospitals who were awarded the ANA's magnet recognition encouraged higher nursing education and more specialized nurses. They also implemented evidence-based practice, lower patient-to-nurse ratios, and better work environments. The ANA aids in the professional development of nurses by offering a multitude of ways for nurses to stay abreast with the most current clinical information. Continuing education courses are offered throughout the year on numerous topics, and certification programs are designed to give practicing nurses a wider skill set. By educating and certifying nurses to provide more advanced patient care, the ANA helps to advance the practice of nursing as a whole. The ANA provides comprehensive guidance for the nursing practice. We have encountered these guidelines in our SMCC education. The ANA publication, Nursing Scope and Standards of Practice, identifies the who, what, where, when, and why, and how of nursing. This provides direction to nurses across the nation and objectively sets out the framework for evaluating nursing excellence. It includes the nursing process and the standards for professional performance. The ANA Publication Code of Ethics for Nurses is a collection of 9 provisions that define the ethical standards for all members of the nursing profession. From ethical dilemmas to healthcare reform, the ANA works to ensure that no matter what the challenge, nursing continues to improve healthcare for all by empowering nurses to navigate difficult moral situations and to fulfill ethical obligations to society. The ANA advocates for health of the nurse in many ways. The Nurses' Bill of Rights is a declaration of 7 professional rights that can help guide the treatment of nurses in the workplace. It ensures that nurses can practice in a way to fulfill obligations, allow for professional standards, and legal scope of practice. It ensures the code of ethics is integrated, that the nurse can freely advocate for patient and for self, and finally, that the nurse receives fair compensation, workplace safety, and the ability to negotiate conditions. For nursing staff and workforce, the ANA provides models for nurse staffing and addresses the shortage and appropriate legislation strategies. For example, in 2019, to ease the nursing shortage, the ANA recommended that nursing students who are deferred action for childhood arrivals recipients, often called Dreamers, be allowed to take the NCLEX in all states without facing barriers. For healthy nurse equals healthy nation. In 2017, the ANA launched an ongoing national movement designed to transform the health of the nation by improving the health of the nation's 4 million registered nurses. ANA believes that nurse well-being must be safeguarded than that ill health registered nurses.
During the COVID pandemic, the ANA supported the safety of nurses. The Chief Nursing Officer of the ANA, Dr. Debbie Hatmaker, met with the White House officials at the beginning of the pandemic to offer the following suggestion. Provide sufficient PPE, align CDC and OSHA guidance on N95 use, promote telehealth to provide care with less exposure, create staffing guidelines that minimize the transmission of the virus, and remove barriers to testing that aid in early detection. The ANA has a notable role in impacting healthcare policy. On a federal level, the ANA acts to lobby the United States Congress and Senate to enact policy that mimics the voice of the American nurse. By having an active role within the walls of Congress, the ANA works to drive its policy agenda in support of nurses and patients. When laws and policies are enacted by federal and state governments, the ANA also works with agencies to decipher and implement these policies. When laws are passed, there is rarely adequate language included in the bill to appropriately implement the law. Federal and state agencies are then left to interpret the law and further clarify how the bill will be put into action. Due to the ANA's expansive reach in these agencies, they have a large part in deciphering the manner in which the laws are implemented and enforced. For example, the ANA has worked with 7 state governments to enact policies that require hospitals to have staffing committees that evaluate nurse staff policies. California requires a minimum nurse-to-patient ratio maintained at all times. Massachusetts passed a law specific to ICU requiring a 1-to-1 or 1-to-2 ratio depending on the stability of the patient. The ANA believes there is a social contract between nurses and society. They advocate for policies to improve health inequities and offer guidance and position statements in areas such as the Nursing Alliance for Quality of Care, Medicare and Medicaid, the Affordable Care Act, the Minority Fellowship Act for Substance Abuse and Mental Health, immunizations, infection prevention, the opioid crisis, and maternal and newborn health.
In 2013, the ANA began to manage the Nursing Alliance for Quality Care, which was previously run by George Washington University. The goal of the organization is to offer quality, patient-centered care. It includes collaborating with other nursing organizations and ensuring that nurses have a direct impact in providing safe care for all patients. The ANA has been a major advocate for the Affordable Care Act. ANA policymakers review proposed changes and lobby for keeping the ACA to ensure no changes that would adversely affect care. For example, in May 2017, the ANA spoke out against the proposed American Health Care Act, which would have partially repealed the ACA. The ANA is actively engaged in immunization advocacy efforts. They represent the nursing voice at influential policy-making bodies, and they partner with other medical professionals and health-related organizations to promote the benefits of vaccines across the lifespan. For example, the ANA has joined with the French vaccination company Sanofi Pasteur for the Race for 200M. The goal of the partnership is to encourage yearly influenza vaccinations to the 200 million Americans who are the most at risk for flu complications. Additionally, the ANA advocates the nurses to also receive vaccines to prevent infectious diseases. This sentiment is reflected in the Code of Ethics for Nurses, which states that nurses have an ethical responsibility to model the same health maintenance and health promotion measures that they teach and research. In 2015, the ANA joined President Obama's task force to address the prescription drug abuse and heroin epidemic. The ANA helped to craft legislation and healthcare initiatives that included the nurse's role in assessing pain, the training for advanced practice RNs to prescribe opiates, the expanded use of naloxone during overdoses, and the ways to support patient-centered care by encouraging access to treatment, recovery, and behavioral health services. The ANA remains concerned that policies continue to lack support, which can deter people from seeking inpatient treatment.
In summation, the ANA was formed over 125 years ago by a group of nurses who wanted to promote the profession by empowering nurses and protecting the most vulnerable populations. That sentiment continues today. The ANA provides guidance to nurses in terms of education and best practices. They advocate for the health of nurses in the workplace, which was most recently demonstrated during the COVID pandemic. They directly impact health policies at the federal level by lobbying and helping to decipher legislation. They also advocate for public health by promoting patient-centered care and by supporting programs that provide safety and protection and minimizing health inequities. For $15 a month, a registered nurse can become a member of the ANA and begin to advocate for the direction of the nursing profession.
Okay, yes, thank you. The ANA can help me expand my skill set.
That's right. I think I'll check out the ANA COVID website.
Ah, yes, the ANA. They can help me with delegation.
The ANA is the perfect organization to ignite health policy changes.
Thank goodness for the ANA and their guidance on DNR.